Thank you, Don. Susan is the Senior Program Officer from the Robert Wood Johnson Foundation.
Thank you, Don. And I always felt a great affinity with Steve Cha, and now I feel an even deeper affinity because I am the last person speaking. So anyway, and just kudos again to NAM and to Peterson Center and to that entire team. I think that during the discussions today and often the questions that have arisen from the floor, I think the complexity, if you will, of the task of trying to bring together some really substantial and actionable information and pathway, I think is very clear, and it's quite an amazing feat. So, we're talking about pretty important stuff today, and so I dare to quote Mahatma Gandhi, who said that a nation's greatness is measured by how it treats its weakest members. And I think, really the sort of the import and the really seriousness of the kinds of challenges that we're talking about really cannot be minimized. And we're also talking about people who are the most vulnerable in our society and who face a multitude of health and social challenges that I dare to say would certainly throw me, and I think would really throw many of us in this room. And something that we also do need to acknowledge is the resilience of many people facing and either, if not overcoming, really living with these really daily, critical challenges. And so we do need to build upon people's and communities' resilience when we're talking about this work too. And I think that City Health Works is an example of how we do that. And I think that working with this group of people as well really tests the inclusiveness and the commitment to equity of our health system, our social service system, and actually our society. So in that note, Robert Wood Johnson Foundation is working with many of you in the room and many, many other partners across the United States to build a culture of health. And that basically is a commitment to a society that enables everybody in the United States, no matter who they are or where they live, to live as healthy a life as possible. And enabling people with complex medical and social needs to live as healthy a life as possible is absolutely core, I think, to building a culture of health for all of us in society. And we know that we need to talk about modifiable, or what was the other one? What was impactable. Thank you. Impactable factors that affect health, and I think that's really come through in the discussions today. We know the statistics around clinical care is a significant contributor to health, but basically to only about 20% of health. And when you step back and you really think about the potential here of our healthcare system working with our social service system, working with our communities to link people with services that can address their social needs and to encourage and support access to such critical services that often fall outside the healthcare system, such as access to addiction services, access to trauma-informed services, access to awareness about the huge impact that trauma has on many people across the United States, and the huge impact that trauma has on many people who later become what we call high need, high cost. And it may be early in life trauma, and it may be current trauma. It may be incarceration. It may be exposure to violence. It may be living in dangerous communities. And so I think that's a really deep factor that falls across this entire population. So we know also that if building a culture of health means that everybody has as healthy a life as possible, we know that it's critical that our healthcare system and that all of our services do everything that we possibly can to measure and to reduce health disparities. But as we've talked about in payment, we also know that many of our payment modalities do not only not directly incentivize reduction of health disparities, but sometimes put barriers to actually addressing them. We know that all of these platforms are also critical to building a culture of health. So we've been hearing, and certainly the report talks about the need for lasting commitment to action that will require bold policy action, that will require system design, that will require payment reform design by really a broad range of stakeholders. We've also been hearing about that today. We've been talking about where the healthcare system is a very important piece, but we have the social service system, we have policy, we have the community, we have housing, we have many other systems that are all critical to work in this area. And we've also talked about really ensuring community involvement. And I think that a couple of people in the questions particularly have talked about this is not just sort of a tick-off list, okay, we got, one community member on our ACO board, but this is for real community involvement. This is for real designing our services and care around the voices of people whom we're serving. And I think that also is coming through in a lot of our discussion here about, segmentation and taxonomy as well. So we know a lot. As we've been talking about, we've also acknowledged that we have lots more to learn. There are many resources out there, many of you in the room. You yourself are resources. You also work for institutions that are resources. The playbook and the work that IHI has done is a huge resource. Another resource that's out there that many of you may know about is the National Center for Complex Health and Social Needs, which is headed up by the Camden Coalition of Healthcare Providers. And that National Center is really seeking to be a hub and a professional home for the multitude of stakeholders that we have learned really need to be involved in not only preventing people from becoming high-cost, high-need, and complex, but also addressing their great needs. And the National Center puts huge emphasis on addressing the non-direct health medical aspects, such as addiction, such as access to affordable housing. And so we know that we have a lot to build off of, and we know that we face many challenges. I think that some of the things that we have just started to touch on, such as the situations that people face in communities, the role of trauma, are all core to really coming up with an inclusive, all of society approach to prevention and to better care. So in the beginning, there were many voices in the wilderness. I think many of you have been fighting the good fight for many years. And sometimes people were really isolated out there in the wilderness. But I think now we have a body of people and we can all howl together and it won't be so dark.
Thank you very much, Susan. We have about